Second panel, we have Dr. Argy Allen Wilson, mental health therapist and relationship expert, Faith Connects LCC, Family and Individual Therapeutic Healing. Hi, Dr. Allen Wilson.
Good morning, everyone. Good morning. Thank you for having me. Thank you to Madam Chair Wascala and Co-Chair Hayward. Thank you for having me, to the rest of your esteemed committee, of course, my good friend, Senator Vincent Hughes, and our esteemed panelists. I am Dr. Argy Allen Wilson. I am the former Director of Clinical Training at Drexel University's Couple and Family Therapy Department. Been there for many years and then transitioned, and I'm also the founder of Faith Inc. or Faith Connects, which stands for Family and Individual Therapeutic Healing, and co-founder of Connections Matter, LLC. In our practice, we are housed in West Philadelphia. We believe in healing families one relationship at a time and transforming relationships one courageous conversation at a time. And I've also worked for many years with Senator Vincent Hughes on his Breaking the Silence campaign. Month after month after month, we have been co-laborers in breaking the silence within the community with regards to mental health and with regards to stigma. So I am pleased to be here to give testimony to what I am seeing as a clinician. So thank you again for the opportunity to provide testimony on behalf of the many mental health professionals that have provided therapeutic mental health and psychological services to families and individuals that are impacted by COVID-19 within the African American community over the last 4 months. As an African American female mental health professional providing services in the community for over 25 years and who continues to practice in the heart of West Philadelphia, I have seen firsthand the devastating impact that the coronavirus has had on its African American citizens. The fact that our community is being profoundly impacted by this novel virus is not a surprise to those of us who work and live in Black communities. What's interesting to me is that it appears that it's been a surprise to other people who don't have their finger on the pulse of what's going on in our communities. We know that historically, when white America is impacted by any devastating trauma, that the impact to its Black American citizens is exponentially greater. In the case of this present pandemic that we are now experiencing due to COVID-19, and I heard many people talk about a second wave, which I believe is going to happen, we know that African Americans have not had the same privileges, whether it be walking through our neighborhoods for exercise or supermarkets and fresh produce or other healthy foods in our homes for preparation, easy access to healthcare as white American citizens. Thus, the devastating impact of this virus continues to have traumatic consequences for us, including death. In order to fully process and understand why African Americans are dying at a higher rate due to COVID-19, this exploratory conversation, or as I would like to say, this courageous conversation, cannot just be relegated to a few simple statements or answers. The easier discussion would be to state that we as African Americans are just more likely to have underlying and pre-existing conditions or physiological conditions that contribute to us being more susceptible to becoming more ill and hence rendering us less likely to recover if exposed to the virus. That's the easier conversation to have. And it certainly makes people more comfortable to correlate the higher rates of health issues, such as obesity and hypertension and COPD and respiratory conditions, with the higher death rates in African Americans across the board. Yet, the question that I often ask my colleagues is, do we want to have a safe conversation or do we want to have a courageous conversation? If we're going to invest in truly addressing the reasons that African Americans are dying at such higher rates than other Americans, and in particular white Americans, then we cannot have this conversation without discussing the historical health disparities embedded within the structural and institutionalized racial inequities that have permeated this country for over 400 years. These racial barriers are cloaked in the stain of racism that continue to prevent African Americans from having full and equitable access to almost every resource necessary for their full and healthy lives. So, racism, not biology, which is anchored in the racist belief that Black people are inferior to white people, underlines the higher death rate of African Americans from COVID-19. And the lack of access to medical and mental health care, education, transportation, information, healthy food due to food deserts, financial wealth, and employment are just some of the barriers that continue to plague us as African Americans, rendering us vulnerable to increased levels of stress that impact our minds, our bodies, and our spirits. Additionally, the social and physical distancing is a privilege. And for many African Americans, this is not a viable option given to based on the nature of the communities that many of us live in. Additionally, there's an overwhelming cultural mistrust when we as African Americans do attempt to ask for help and often are turned away or left to fend for ourselves, as many of our esteemed colleagues have said already. In this case of COVID-19, many African Americans have been turned away from medical facilities, even though they tested positive. And when refused testing, later on when they test, ultimately they're left to die in the homes with no medical care. Those numbers are yet to be counted. The COVID-19 Black Doctors Consortium, as someone else said, led by Dr. Ayla Stanford and many faith community leaders such as Pastor Marshall Mitchell and Pastor Alan E. Waller, led the charge in our community in Philadelphia and nearby districts while meeting the need for testing due to the lack of resources on the ground. Experiencing these overwhelming stressors have the propensity to take a toll on human beings if there is no relief. Many professionals have discussed that in order to fight this very complex novel virus, we as human beings have to build up our immune systems to prepare for our bodies for the fight if we are become exposed to it. I would submit that for African Americans, it is not just our physical immune system that needs support, but also our mental and spiritual well-being that is compromised on a daily basis, hence jeopardizing our overall immune system to fight this virus. We, in fact, are fighting two viruses, COVID-19 and racism. Many of my clients tell me that the stressors of everyday life are enormous on every day of their African American communities. Now, with COVID-19, a 12-week quarantine, job loss at an all-time high, rising death rates, the pain of complex grief, and most recently, the uprising of the racial unrest leading to the protests due to the outrage of continued assassination of unarmed Black people at the hands of those who swore to serve and protect all people. Many people feel like the deck is stacked against us and that their lives, our lives, as African Americans and people of color, do not matter. This is the state of African Americans in our community, which has led to higher rates of domestic violence. This is what I'm seeing on the ground as a therapist, more child abuse, substance abuse, major depression, and major anxiety. It has been stated that pressure bursts pipes if there is no relief. James Baldwin stated that to be a Negro in this country and to be relatively conscious is to be in a rage almost all the time. Our African American community has continued to suffer for hundreds of years, and if we are serious about addressing the higher death rates due to COVID-19, we must address the structural inequities at the policy level across the board and give more attention to the whole human being, including mental health and wellness. I hope this is helpful. These are the things that I am seeing on the ground. I pray that we do our work necessary to enforce and make note that the monies that are coming into our state should be for the Black and brown people that are suffering. And I lastly would like to say that we have some esteemed panelists. I fully believe that people don't care how much we know until they know how much we care. For Black and brown people, they're up against it. We're up against it. And so therefore, oftentimes when we do go to get help, we are faced with other people that look in our eyes and they don't care, and we see it. So I thank you for giving me the opportunity to give this testimony, and I will stop there and give the stage to someone else. Thank you for consideration.
Thank you, Dr. Allen Wilson. You talk about courageous. You're one of them. Thank you very much. Straightforward, open, honest. That's what this hearing is all supposed to be about. So thank you very much.
Thank you.
We have, yes, we have Dr. Millet